During the whole history of humankind, people were facing similar problems, pain in all parts of their bodies. The level of energy in a human being suffering with constant pain is quickly decreasing, as well as effectiveness of their work and feelings. Every year in the world, millions of children are treated with scoliosis. According to the traditional method, in the early stages of the disease, for prevention of increasing of tilting of trunk, a brace is used. It stops the curve from getting worse. If later the curvature increases, surgical treatment is recommended with the usage of metal implants. Since the child constantly grows up, these methods, brace and surgery, which do not exclude reason of a disease, have only supplementary character. At the age of 7 to 9 months, when the child starts walking, the position of its body is fixed in vestibular apparatus and cerebellum of the brain, due to the creation of a reflex of vertical position of the body. Such a reflex should be named as a wrong one, since it fixes wrong posture with tilting of body to right or left. In his medical practice in Ukraine, Professor Valentin Serdyuk, who treated more than 9,500 patients with scoliosis and back pain, discovered that the tilting of the body is grounded with the laws of nature. Since our body is asymmetrical, therefore our brain functions also asymmetrically. The left brain's hemisphere, in comparison to the right, is more active in 95% of cases. Such different activity of hemispheres leads to asymmetrical tension of the spine's muscles, resulting with the tilting of the body. Professor Serdyuk also discovered the tilting of the spinal column in cases of presence of malformation of lumbar and sacral vertebrae leads to regular rotation around the axis of the spine in all parts of the spinal column, what is causing wrong scoliosis posture. Consequently, for eliminating scoliosis posture, it is necessary to restore spinal pelvis balance and provide connections for the creation of new correct reflex of vertical position of the body. Investigations of Valentin Serdyuk have shown that creation of the reflex of correct posture is possible with usage of orthopedic shoe inlays from the side of relative shortening of the leg. Constant usage of this shoe inlay restores symmetrical functions of the spine's muscles. It leads to a liquidation of the pelvis tilt, and as a result, spinal pelvic balance becomes normal. Then it is preserved in the cerebellum. The practical importance of the method lays in the creation, during the first years of life, of correct posture of a child and prevention of scoliosis disease. The method of creation of new, physiologically correct reflex of vertical position of spine is defended with 2 diplomas for scientific discovery and patents in many countries of the world.